Thanks so much for joining. I must say, if I were a medical student, I would have skipped this talk after such a fabulous morning, a shortened lunch break, and now these glitches. I would have treated myself to an extra Heineken and a siesta. And rather than go and listen to an aging GP talking about something very woolly and washy like children's communicating with children. But in a way, this is the most important talk of the day, because whenever you're dealing with children, be they your patients, your children, or your grandchildren, you'll be using some of this stuff with all of them. It was very interesting to hear Will Carroll bemoaning his age. Handsome young Will Carroll. God, when you get to my age, Will, you're almost like a fetus. Enjoy your youth while you're young. I started in general practice in 1972. And in the 70s, my real hero in gastroenterology was a top gastroenterologist, an Irishman from Glasgow called Jerry Crean, who ran a dyspepsia clinic. And this is a quote from one of his lectures that just blew me away. He said, "You're not going to believe this, but I'm going to tell you anyway. If a patient comes to my dyspepsia clinic and points with one finger as the site of the pain, that is virtually diagnostic of a peptic ulcer. If he uses two fingers, that's not half so suggestive. And if he uses the whole hand, you can forget it." I was just thrilled with this because, like most of us here, I just rejoice in clinical medicine when we play Sherlock Holmes trying to reach a diagnosis, and anything that makes it better for us and more fun is up there. So can you imagine? I was just dying to see my first dyspepsia patient to put it to the test. And this was the first one. This is a questionnaire. By the way, kids, questionnaires are just wonderful. There are few things anywhere in the world, never mind medicine, where you save time and you improve the quality of your care. Now, when you look at this and you can see how old it is, it's relieved by food. Can you see it's a stabbing pain, relieved by food and drink? It wakes him up in the early hours of the morning and he takes milk, dry biscuits and chocolate to bed with him to relieve the pain. This is a barn door peptic ulcer. And in those days, that was a big deal before we had the H2 blockers and the PPI inhibitors. It was a big deal. So I know the diagnosis from the history. So I said, "Will you show me with your hand where the pain is?" Yes, it was the one finger. I was so thrilled with this. I nearly leapt for joy. And in those days, you can tell how ancient it is. We did barium meals and things in those days to prove it. And there is a barium meal there. And I haven't got a pointer, so I can't reveal my ignorance in trying to point it out to you. Well, I thought, wouldn't it be great to use these hand signals with children? Now, why would I want to do that? First of all, recurrent abdominal pain in children is very, very common. 10 to 20% of all school children have a recurrent abdominal pain. It's more common in girls. And indeed, it peaks at the age of about 5, and then at the age of about 10 to 11, when 25% of schoolgirls have this. Dr. Saxena from Delhi pointed out recently that it may have increased a bit during lockdown in a very recent talk. And I thought, yeah, I bet it has. There's a lot more stress on kids. Now you'll see the hand signals. This is typical. The two hand signal pointing around the umbilicus. There they go. Can you see them? And this is the other one, because there's two hand signals that give you the diagnosis. The cupped hand, the serious look. Remember these pictures, let them burn into your memory, because you're going to see these kids, you're going to see them, and this is virtually diagnostic. When I was thinking about this talk and I was reviewing the literature and going back into my old notes on it, I looked at an article I'd written on recurrent abdominal pain back in 1983, and nothing has changed since on that. In fact, nothing had changed before, since the work of the great John Apley. Look at that hand and that expression on the face. Diagnostic. The great John Apley of Bristol, whose book in 1958 set the seal on this whole clinical scenario. John Apley of Bristol, and really even reading the latest literature, they still doff the cap to the great John Apley and his work. I'm talking about the great John Apley of Bristol, who delineated in a wonderful disquisition the whole panoply of recurrent abdominal pains in childhood. Further from the umbilicus, more likely to be organic, that it was nearly always a manifestation of anxiety in the child, anxiety and stress, and that very often there was anxiety and stress in the family, most often the mother, that it was related more to school events, bullying, a teacher who shouts, various other things, school events, and it was psychological. The big danger, first of all, we dare not miss urinary tract infection, and it's malpractice not to test the urine in these children. The biggest danger, he pointed out, is of over-investigation. That is the real danger. The further away from the umbilicus, the more likely it is to be organic. And this is what John Apley said. This is a summary of his and some other ideas on it. Almost always a manifestation of stress in the child rather than organic. Family members, especially mother, more likely to have similar complaint. Help the family to cope rather than cure. Further from the umbilicus, more likely to be organic. Failure to test the urine is negligent. Find the family's secret fear. This is the most important single thing of all. If the family go away harboring that secret fear, we're not going to get anywhere. I call these tension tummies by analogy to tension headaches in adults, and over-investigation can damage the child. Treatment begins with the first words of the first consultation, and it's the first consultation which is the most critical. So let's just go into the scenario of what happens in an ideal case when we're dealing with a child who may have recurrent abdominal pain. We're going to take a good history from the mother. There are particular questions we want to ask. Of course, is the child thriving? Maybe think about doing percentiles if they're anything less than thriving. Any associated symptoms? Ask about bowels, sleep, all the usual stuff. But the most important question, bar none, is finding the secret fear. Now, if you ask a mother and you say, is there anything that's you're afraid of? They're embarrassed to give us an answer, and you've got to boogie around it. I say, has anything either crossed your mind or been suggested? Maybe you've seen on TV or from the lady in the post office as to the cause of the pain. Anything to allow the mother distance to give their own secret fears. So you take a history. Very often I will give them a questionnaire to fill in the waiting room if it's appropriate. Then we go on to the examination. And we examine the child, and I guess we all do a similar kind of thing. Hello there, what's your name? Have you seen my magic light? Oh, this is a special light. It makes some children laugh, you know. Did you know that? Yes. Now, when I look in your ear to see if there's a bunny rabbit, will you try not to laugh? And you look in their ear and see if there's a bunny rabbit. And sometimes the kids really will laugh out loud. So you look in their ear. Don't forget, no examination without reassurance. Oh, this is beautiful. This is perfect. Oh, I can see what a clever little girl you are. You're really clever. I bet you're a teacher's pet, aren't you? Yes. And then you go on to listen to the heart. Oh, what a lovely, powerful heart you've got there beating away. And we'll examine the lungs. Now, in my bitter experience, children cannot take a big breath on demand. Some of them even struggle to blow out my little magic light. But if you say, will you help me to blow out your magic light, like your birthday candles, they will join in. And while you're listening to the lungs, and then you compliment them, you say, my word, you are a very good breather. Have you been breathing all your life? Mum will smile at this stage. Oh, and that's a prompt to remind me, never examine a child until you've made the mother smile. Then we go on to the abdomen. And we examine the abdomen very carefully. I want to be sure that they haven't got a loaded secret, because constipation, as you know, that's just lactulose deficiency. and I make the tummy squeak, you know, while I'm doing it. And we check all over the tummy, checking for organomegaly, any tenderness, anything. I do a very careful examination of the tummy. Sometimes the children will feel the tummy after I've gone, see if they can make it squeak. And I must be good at this. Once our nurse, and the nurse said to me, by the way, doctor, how do you make the tummy squeak? So I've taken a reasonable history. I've done an examination. I've tested the urine at least once. And then, have I got a secret fear to deal with? Mum or me? I mean, if anything's crossed my mind, if sickle cell or lead poisoning or Mediterranean fever, chiloditis, anything that we've got to nail, because it's only when I'm happy there's nothing going on, no organic illness. When mum's happy there's nothing on, then we go on to the contract. And I tell the mum, I tell them what it is. I say, your child is suffering from a tension tummy ache. It's like a tension headache in grown-ups, but there's nothing wrong physically. It's just related to stress. And I've done a little handout, which you can all have before you leave, a tension tummy ache, spelling out exactly how to do it. I will sometimes say to mum, would you mind coming back in about 3 weeks? I'd love just to have another look at you. In the meantime, it would be nice if you read my handout, and if you keep a diary of when she gets the pain and when she doesn't get the pain, and a food diary. I've increasingly been interested in a food diary because of Kate Stein, some brilliant work at Cambridge with Teddy Laboratories, that 30% of children think that their tummy may be related to food. Food exclusion diets are not so good, but they're not okay. And then you'll see them in 3 weeks, maybe with a completed questionnaire if you want to go that way. And then you're pretty well finished. And that's the way things should go ideally. So how do they go when things are less than ideal? Well, this is my handout. I can't remember if it was me or Einstein who said originally, make things as simple as possible, but no simpler. And this really is a very, very simple handout that I give to the parent to check it out. So what's a bad outcome? This was a study done many years ago in which they got 102 children. Can you see what they did? They investigated them extensively. They all had barium studies, upper GI, small bowel and enema, proctoscopy in 90 of them, in the knee chest position. Ouch, IVPs in 40. This was over-investigation at its worst. And it ended with the child feeling that the abdominal pain resulted from something dangerous, mysterious, and not susceptible to help, a feeling of helplessness. This is the face of total failure. This is what we want to avoid. You may think, well, surely with the new non-invasive techniques, it's worth doing other tests on these children. No, I draw your attention to Group C in this study, where the 598 typical children with typical recurrent abdominal pain, absolutely typical, only 1% of them had any abnormalities on ultrasound examination. And even those, when you look at what they were, we would have picked them all up, wouldn't we? Because we've tested the urine religiously and we felt for any fecal masses. So there's no need to do any further tests. Oh, this is my passion for lactulose. Constipation is lactulose deficiency. It's not just a wonderful, with an incredible dosage range to suit the children. But it's also a prebiotic. It's a wonderful drug, but just to remind me, any drug can cause anything in anybody, anytime. And I've had to learn that lesson so many times. Can you see the hand signal there? You've got to investigate the kidney there. This lovely little girl came to see me. We diagnosed tension tummy ache. And then one day she was holding her mum's hand going to school. And she looked up to her mum and said, Mummy, I don't get my tension tummy aches now. I don't have to read the big book. This little kid had to read the big book in front of the class, and that triggered off her tension tummies. This fabulous little girl, she had congenital dislocation of the hip. Somehow it got missed. And she had to have 7 operations on her hip. Can you imagine this? Poor little kid already has a horrible medical burden in her life, and to give her something else to worry about would be an awful thing to do to that kid. This lovely little girl, again, who's turned into a fine adult, by the way. Father hung himself, mother schizophrenic. Again, think of the burden of worry on these children, and to spare them an extra dimension of over-investigation is really good medical practice. This poor little kid, she was a temporary resident brought by the grandmother, and we made the diagnosis. And I was saying, is there anything in your life? And grandma told me that this little girl had been sexually abused by a stepfather, and she had to stay away from the home of the stepfather and her brothers, the people she loved more than anybody else in the world, and live with the granny many, many miles away. I don't believe in prayer, but if I did, I would certainly say a prayer for this little girl, and I do hope things went well for her in the end. Okay, so that's the way we tackle pain. Of course, it's not just the child that we're talking to. It's communication with children, but the communication goes with the parents, and sometimes it's indirect. As with the 6-week-old check, we've all done these, and if we want to do a very thorough check, we want to make sure they're hearing okay, their eyes are okay. We want to be sure they haven't got a congenital dislocation of the hip. Oh, yeah, we're going to do Barlow's, Ortolani's, and the tuning fork tech. Make sure the milestones are on strong. And it can get pretty boring after you've done a lot of them. So this is what I say with all these remarks addressed to the little baby. Oh, what a lovely little baby you are. You are so fabulous. Now, I've got some instructions from head office, from the baby union, and they want to make sure that you're waking up during the night. Oh, yes, at least twice during the night, and make sure that mummy and daddy are woken up too, so that they're suffering from a shortage of sleep during the day, and then they will be very vulnerable to all the things that you've got to do. Next, in the guidelines, it says it quite clearly, you have to be faddy with your food. Spit out your food and make a mess. Oh yes, drop it on the floor and keep spitting it out as though you're not interested. And mummy and daddy will play games with you then. Oh yes, they will. They'll play aeroplanes going into hangars. You'll have a lot of fun with that. Next one you've got to do is, of course, colic. You draw your knees up and you scream at the top of your voice, absolutely screaming. Now, the guideline says it's best to do it in the evening when they're having the Chianti and bacon sandwich or whatever, and they're trying to relax after a hard day's work, because it works a lot better if you do it in the evening. In fact, the boys at head office have called it evening colic just because of that. And then you can do breath holding. You hold your breath until you go blue. And this scares the bejesus out of your mum and dad. You'll have a meeting out of your hand, so that when it comes to potty training, oh my gosh, you are going to have the most fun you've ever had in your life. You're going to have such fun with potty training. But I hope to see you before then, and I'll bring you the guidelines from baby head office and show you how to have even more fun. The nice thing about this is that your mummy and daddy will not be very keen on having another baby very soon after this, and you will remain, as you should be, the centre of attention with everything revolving around you. Well, kids, I'm enjoying communicating with children and the parents, and I'm doing a reasonable job. But there's something I'm missing, because children live in a different world. Children live in a world of puppets and fairies and all kinds of fantasies. Then I had an idea one day, and for some reason I had a sooty puppet, and I thought, I wonder if that could help. Well, I look at my next patient. Oh, it's a little girl called Lauren, and she's only 7 years old. She hasn't been before. She might be a bit nervous. So I go into the waiting room with Sooty, and I say, does anybody know a little girl called Lauren? Does anybody know a little girl called Lauren? Anybody? Where's the, are you the famous Lauren? Is that you? Are you the famous Lauren who organises these fabulous parties at Kiel? How would you like to come and meet some of my puppets? All my puppets want to meet you, you know, and we can have such fun. Do you know how to blow bubbles? Do they teach you at school? Because I can blow some wonderful bubbles and we can have some fun. So just follow me, follow me, follow me. And the child follows you into your consulting room. By the time you get through the consulting room door, you're friends with the child. And of course, Sooty does a bit, and I've got other puppets. It's funny how children often had their favourite puppets. This is Marilyn, and this is Rambo, the Psycho Killer Bunny. For the very tough children, not for everybody, they all have their own favourite. But Sooty remained the star, of course. And of course, Sooty's very useful for some other things as well. Like, for instance, we're very intuitive as GPs, you know. Sometimes you can tell from looking at mum that she's not entirely happy with what you've said. And you say, you don't look quite happy about that, mum. Would you like a second opinion? You know, just to put your mind at rest. I won't be offended. OK, just a moment. Sooty, you've heard all this, haven't you? What do you think? And yes, that Sooty actually tends to agree with me on this particular one. OK. So I got a reputation for being very good with children, and I felt an imposter. I know how good Will Carroll and all the consultants are at the hospital, all the things that you know and can do. I felt an imposter. But I had this reputation with my patients as being good with patients. Then one day I got my total comeuppance. This lady brought a 7-year-old daughter and she said, "Oh, doctor, you've got to help." There was real anxiety in her voice as well when she said it. I said, "What's up?" She said, "Oh, since the next door neighbour died, my 7-year-old daughter's having nightmares. She's having panic attacks. She won't let me out of her sight." I said, "Well, I'm only an ordinary GP. What can I do to help?" She said those terrifying words that were like a double-barreled shotgun pointed at my temple. She said, "No, doctor, you never let us down." Ouch! What can I do? What would you do, kids? What would you do, kids, with a case like that? Well, hold that scenario and we'll come back to it. I actually have 3 children of my own, one of each. The youngest is rather badly behaved, and if he'd been the first, he would have been the last. My wife and I are both absolutely certain about that. People who get to know him think he's from another planet, such as Mars, but people who really know him think he's from somewhere much, much further away than Mars. His behaviour was, and when we met our friends, the first thing they wanted to know, "Oh, tell us the latest Henry stories." I'll give you a couple. My wife swears he wasn't even 4 when he went to see Father Christmas once. And he told Father Christmas exactly what he wanted for Christmas. And then he said, "Can I ask you another question, please, Father Christmas?" He said, "Yes, little boy." He said, "Can I have your job when you're dead?" And then another time it was a weekend, and very often my wife and I would both be working. I'd be on call, and my wife was part of an adult education course, and on this we toss who gets Henry, and she lost. She got stuck with Henry, and she's taking some adults around Whittick Hall in Stafford. You may know Whittick Hall. It's a wonderful stately home, and 18 grown-ups, 1 guide, my wife, and 5-year-old Henry, and they go around the hall, and then of course the guide says afterwards, "Any questions? Any questions, anybody?" One little boy puts his hand up. "Yes, little boy." He said, "What kind of animal is that on that picture there?" He said, "Well, what kind of animal do you think it is?" He said, "I think it's a porcupine." He said, "Very, very good. Many children of your age would think it's a hedgehog, but it's not. It's a porcupine." Right, any more questions? Anything? Any more questions? Anybody? Anybody? "I've got another question." They're beginning to titter now. He said, "Yes." He said, "Which planet is nearest to the sun?" The guide played along. He said, "Oh my God, I've never been asked this before. He said, is it Mercury? Henry says, correct. But Henry was a nightmare right across the board. Even when I'm on call, I'm answering the call, Dr. Shevlin speaking. Henry says, don't say you're Dr. Shevlin. Say you're Henry's dad. All right. Henry's dad speaking. Henry's dad speaking. Yeah. Anyway. So can you imagine if I've got to hold Henry's attention, the stories are going to be wild. They've got to be wild to hold his attention. And he's got to be in the stories. So I started telling these stories about Henry and his pet elephant called Ho-Ho, because he was laughing all the time, who lived in a tree, a tiny elephant that lived in a tree. And every morning, Henry would call up and the tiny elephant would fall to the ground and become a massive, full-size elephant. Henry would strap on roller skates on the elephant's feet, climb on the elephant's back, and they would go off having these amazing adventures. And those were the stories. And my eldest boy, very forgiving of me, he said, I like these stories. Why don't you write them down? So I did. I typed them out. Okay. Now let's go back to the surgery. I've just had somebody, remember, 2 barrels pointed at my temple. You never let us down with a kid who's been spooked by the next door neighbor dying. I said, well, I don't know what to do. What I'd like you to do is, and I got these stories, I happen to have them with me in rough, no pictures. Would you mind reading her one of these bedtime stories every night and then phone me up and tell me if she likes them? She phoned up about 10 days later, said she adores the stories. She loves the stories of Henry and Ho-Ho. Well, then I took some more details. I took some more details about the little girl and about the death and stuff. And I wrote a special story in which she appeared with Henry and Ho-Ho dealing with this problem of death. Rather disguised little girl, the cure was instant. I thought, oh my God, I've hit on something really special here. And from then on, whenever there was a child with a problem I didn't know how to tackle, I'd try and write them a special story after they'd got familiar with the characters of Henry and Ho-Ho dealing with their problems. So, though this is a real picture of Henry, by the way, and Ho-Ho the elephant, and you can see this on my website, of course. They really are amazing adventures. Well, I got the book published, and it hadn't been out very long. And I had this letter, dear Dr. Shevlin, my name is Elena, I am 7 and I love reading and chocolate. I took the Henry and Ho-Ho book home and read it all. I loved it. I liked their adventures and Henry and Ho-Ho. I would like a book where I could become friends with Henry and Ho-Ho because I have bone cancer. Love, from Elena. I don't know about you, when I saw that word bone cancer on her letter, the back of my head prickled. I felt a cold shiver. I thought, how can I help this poor kid? I've never met her. So I wrote a special story for Elena. Don't forget, she had chemo and she'd gone bald. So in it, she had a special hat. And they went into Sherwood Forest, because she lived near Sherwood Forest, with Henry and Ho-Ho, and they saw this magical herd of deer, and she was enjoying watching them. And suddenly there was a tinkling sound, and the herd of deer just spooked and ran off. The tinkling sound had terrified them, and they'd all ran off. And do you know what it was that had scared them? It was a little baby deer with a bell around its neck. Now, Eleanor realized that as long as that little baby deer had a bell round its neck, it wouldn't have the protection of its family and its mum and dad. And so at dead of night, she very bravely went into Sherwood Forest, and when the little deer was asleep, she took the bell from around the deer's neck. And of course, I sent her the story, but I also sent her the hat and the bell. And I call myself Uncle Dennis because he's a character in the story. Thank you for the magic hat and the bell and the book. I really like the sound of the bell. P.S. I always take the bell to hospital with me. So when she's going for chemo, she always took the bell with her. I mean, isn't that wonderful? But suggestion is incredibly powerful. And of course, children are in a really suggestive frame of mind when they're having a bedtime story and being read by their devoted parent. Now, when we think of all the other suggestions that are available, one of the most powerful, I've really got to think about this, is the smile. You think for a moment, kids, about the first communication you had from your mum when you were a little baby. The very first communication that told you that we love you. There's no bogeyman outside. Everything is safe. What was it? It was your mother's smile. The first communication you had as a baby to tell you that everything was okay. But what does it say as a doctor? When a doctor smiles at a patient, like you, we're on your side. We've dealt with this before. We know what to do. Don't be pessimistic. The outlook's really good. The smile is so powerful. I've used a lot of clinical hypnosis over the years, which is just a formalized use of suggestion. This was a bunch of school children I was hypnotizing to improve the performance at school. Some kids when they were struggling, other ones just wanted to do better. And after I'd woken them up afterwards, this boy woke up with a red mark on his hand. Now, nobody had touched him, I swear, but in the hypnotic fantasy, he'd been scratched by a wild dog. Don't go into it, but there was a mark. Anybody doing clinical hypnosis knows that a suggestion can produce an idea. This was Claire. She had bad acne. I'd really tried to get her fixed. Nothing doing. I'd bombed. Then one day she came back cured. I said, Claire, you look fabulous. What have you done? She looked a bit hesitant. She said, well, I've been to see a chiropractor. Oh, my God. And the chiropractor explained that acne was caused by poisons in the blood. Oh, yeah. She said, and the chiropractor explained that the liver was the big detoxifying organs in the body that would take out all the poisons. Oh, yeah. And by chiropractic adjustments to the spine, improved the blood supply to the liver, took out the poisons, and that's why I'm doing well. Now, for heaven's sake, I don't accept that explanation of what went on. But God, that was a placebo effect, wasn't it? Just think for a moment the placebo effect. Drug companies hate it. They spend tens of millions on developing a drug, and then 35–40% of people have the nerve to get better on dummy tablets. It's absolutely awful for them. And that's only in the circumstances when you say to them, you might be receiving the wonder drug or you might be receiving the dummy tablet. It's a toss of a coin. What happens if you test the placebo under perfect conditions, with all the dominoes stacked up in our favor? I'll defend this anywhere. The placebo effect is over 80%. Don't forget, in ancient times, it's only recently that we've had drugs that are actually pharmacologically active. In old days, all they had was placebo. They used crocodile dung, hoof of ass, swine's teeth, usnea moss, scraped from the skull of a hanged criminal. But don't look down on these old doctors. These ancient doctors of old, they had a higher status in society. Proportionately, they made more money than we do, and all they had was the placebo effect. We've got to maximize our placebo effect, and that is really one of the arts in medicine. And if you ever hear anybody say, oh, it's only the placebo effect, kill them. Kill them. They certainly have no right to sit at a table of making any kind of clinical decision making when we're dealing with real patients, because we know just how powerful the placebo effect can be. Oh God, I was hoping I'd left this out. This fracture, I hope you can all see it. This fracture belongs to the worst behaved child I have ever encountered in my entire life. In my whole clinical practice, I've just never met anybody as badly behaved as this. And it's not just me that thinks this. All our nurses, all the other doctors in the practice, all the staff agree that this boy is a nightmare, and his parents are so incompetent they should never have been allowed to have children. I've never said this about anyone else, but all of us believe that we should have prevented them from becoming parents by sterilizing them both. Yes, by sterilizing them both compulsorily if necessary, and maybe putting the wife on the coil and the pill as well. Because this, I know I'm going to get hate mail about this, but I've got to tell you the truth. I've got to tell you the truth as it really is. So when my son Henry broke his wrist, we knew that we were in deep trouble. Because he needed to have a general anaesthetic to put this fracture back in place, and he needed a general anaesthetic, therefore he had to stay in hospital overnight. And of course, no way did he want to stay in hospital overnight. No way. He screamed. His sister had told him, unfortunately, that hospital food was poisonous, and there was no way that he was going to stay in hospital. What would you do, kids? I said to the orthopedic surgeon, who remains, God bless him, a friend of mine to this day. I said to him, do you mind if I try hypnosis? He's a wonderful guy. He said, I know where you're coming. I even might try the same. He said, but look at that fracture. He's going to scream and he'll never forgive us. Those were his exact words. So I went ahead. I want you to imagine, here I am in the A&E, and I've got Henry here, this naughty 7-year-old boy who I'm trying to hypnotize. His mother's somewhere over there. There's an orthopedic surgeon here, another orthopedic surgeon, senior nurse there, and me trying to hypnotize Henry and get him deep enough to have this done. I tell you, kids, it seemed like hours going deeper and deeper, more relaxed and calm, your body going down, all that stuff. After what seemed like an eternity, I eventually looked up and said to the orthopedic surgeon, you can do it now. Do you know what he said? Do you know what he said? I've already done it. And God bless him, he had. He'd moved in and put the fracture back, and there you see the thing in place. And I'll show you a picture of Henry in his cast at that time. And I would strongly advise anybody, if you see an apparition like that coming anywhere near to you, then I would make a run for it. Now, well, this has been it's been a pediatric meeting, of course, and you never leave a children's party without a present. So these are the things I'd love you to take. I've written a simple guide to parenting. I've heard some bits of wisdom over the years, and I got them all together in a handout. I got my wife to contribute. After all, she got the distinction via of helping to bring Henry up. My daughter, who's fabulous on communication, my sister, who's a social worker, anybody. I got everybody to contribute, and it's brilliant, and it's yours free of charge on my website. My handout on recurrent abdominal pain is dead simple. Don't accept any of these, by the way. Take them, print them out, change them. Multiple questionnaires. I use questionnaires on anything. Just repeating that remark, that there's so little anywhere in the world where you save loads of time and you actually improve your performance. The stories of Henry and Ho-Ho, if you're too mean to buy the book or whatever, you can get it free of charge on the web, and you can get all of these on my website. That's my website, and if you're having any problems at all, then just get in touch with me. You can have my telephone number if you want. I'm sure the fabulous Lauren will let you have those. Just before I go now, just let me do one quick thing. I've got to share this with you. One day I had a nightmare of a clinic. One of my partners was away, and it was wall-to-wall patients. It was a nightmare, and right in the middle was the most grumpy old bugger on my list. I thought, God, I can't face this lot. I'd rather be in prison or in Beirut than face this lot. I cannot face them. What can I do? I thought, I know what I'll do. When this miserable old fella comes in, I can have Sooty up. I've got a big desk and I won't look up. I'll pretend I'm expecting a kid. I'll get away with it, I think. So flash next, please. And I can hear this miserable old bugger trundling in. And I hang on for as long as I possibly can, pretending to do something. And then I looked up and said, oh, it's you. I'm terribly sorry. I was expecting a little girl called Lauren. Sooty, get back in your drawer. You're not supposed to be here when this going. You know what he said? Do you know what he said? He said, but I like Sooty. You know what else he said? And these words influenced me from that day onwards. He said, Doctor, I always make a point of seeing you because you're always so cheerful. Ah! But then I began to realise that happiness spreads, and went on about the therapeutic power of the smile, but it benefits everybody. Happy people are good for you, and you are good when you are happy, are good for everybody else. Surround yourself with happy people and make people who surround you. Now, we've been in the throes of an awful virus, an awful epidemic at the moment, but happiness is also an infectious disease. And hopefully, when we take our masks off and smile, we can all be part of a much nicer epidemic. Thanks so much for listening. I apologise again for the glitches. Thank you very much indeed.
Great, thank you so much, Dr. Shevlin. I think the comment section is just lit up with everybody saying thank you. We really appreciate it. You always bring so much charisma and enthusiasm to everything that you do. So thank you so much for that.